listen carefully, if you're defrauding Medicare, start running, because we are coming for you. Don't walk, run away.
Administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz, joins me. Nice to talk to you, sir.
Same, Greta. Well, that video, as you know, concludes with us showing a bust on a husband and wife couple living in a massive mansion in Los Angeles with ill-gotten gains from their hospice business. So they were taking advantage of seniors who were critically ill, lying about how sick they were, and then stealing money from them and from the federal taxpayer. So it's a part of the president's desire, and the task force led by the vice president is making sure that it comes to fruition to take out bad apples. And you want to see people in handcuffs? That's what's you can witness it with healthcare fraud coming up.
Can you give me some idea? Is there any way, I mean, how much there is a year? Because I looked for just Medicaid fraud, and for instance, 2021 it said 98.7 billion. That was my research on it. But I mean, do you have any idea how much fraud there is in any particular year? This year, last year?
Well, we think it's north of $100 billion a year, so I think your estimate's pretty accurate. But let me put it in context, because a lot of folks don't know what that much money could do for you. If you're working right now and you're worried about being able to afford to retire at 65, and if Medicare is going to be there for you, if we could stop the fraud in Medicare, it would double the life expectancy of the Medicare Trust Fund. That means instead of it expiring 5-6 years from now, it'll go twice that much into the future before you'd have to worry about its solvency. That should give you a peace of mind that you otherwise can't imagine having, that you would have that much support. And that's just from taking the fraud out. We don't have to increase your taxes. We don't have to take money from anybody. We don't have to throw anybody off these programs. Everything stays the same, except you stop the bad guys from stealing money.
Well, the other thing that sort of bothers me about healthcare is, look, I'm lucky, with healthcare, but if you're very poor, you probably can go into an emergency room and get cared for. But there are a lot of hardworking people out there who can't afford the Affordable Care Act. Is there any way, and I realize it's a different program, but they can sort of recapture or claw back some of that fraud and at least help these people out? Because I'm hearing what they're paying a month, and I practically fall over at the amounts.
We can claw some of the money back, but Greta, the most important thing for us to do is make sure the money never leaves the building I'm in right now. I'm at Health and Human Services. This building doles out close to $1.8 trillion a year. That's twice the defense budget. So we spend a lot of money to provide high-quality care to 170 million Americans. We just got to make sure the right money goes to the right person for the right service. And so there's all kinds of tactics we're using. Some of them, by the way, are going to be dramatically enhanced with the use of newer technologies, artificial intelligence being some of that. But at its very core, if you can steal $100 billion from the federal government, that speaks to a much deeper problem here. Like, what's the motivation to allow that to happen? And what happened since the beginning of COVID that allowed this fraud to increase so rapidly? And part of it, I've got to say, is there was not a lot of focus on the issue. Just like with the border, there was massive amounts of immigrants illegally coming across without anyone seeming to be able to stop it. We have an analogous situation here. It grew so fast, so quickly and folks weren't focused on it. We can stop it. We just got to put our focus onto it, and that's what the president's doing with the task force.
Am I incorrect in this? It seems to me that the funds come from the federal government for the most part, and then they go to the states. And so we sort of trust the states to use it wisely, but that they're the ones that are should be the ones who are sort of the monitors of how this money is used, whether it's fraudulently or fairly. I mean, are the states up to their eyeballs in this? Are they more to blame than the federal government?
Well, I think the states on the Medicaid side have an obligation to patrol a program that has changed dramatically. Why? Because we're now paying oftentimes for services your family would have performed for you, like driving you to a doctor's office, carrying the groceries upstairs, simple things, tasks around the home. And these were designed, again, for a good reason, to keep you out of a hospital, out of a nursing home. But these are not regulated endeavors, so it's easy for people to steal money. And now I've got to say, Greta, it's not just small-time operators. We've got organized crime involved. We believe foreign governments have engaged in this. But the biggest issue we've got to challenge ourselves with, Greta, is this really a flaw, or is this maybe a feature for some of these states? The #1 job in New York State right now is a personal care service. That's carrying the groceries upstairs, again, for your parents or someone in your neighborhood. That's the #1 job in the entire state. So these programs have become jobs programs. And in some states, California included in this, there's evidence that unions have gotten involved in supporting some of these programs. So now all of a sudden you have political patronage as a possible motivation for why the system hasn't been well policed. So just like we tolerated illegal immigration until the president came in and he clamped down the border successfully pretty quickly, we can do the same thing with the fraud, waste, and abuse in the healthcare system. And we have to do it. If we don't protect our most vulnerable from thieves corrupting the system, shame on us.
Indeed. Dr. Oz, always nice to see you. Thank you, sir.
Stay well.
People think news just happens. It doesn't. It happens because there's someone there to capture the moment, to explain it and share it. That's my job. I go where news breaks and give you the facts. Join me for The Record on Newsmax.